Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I want to welcome Dr. Todd LePine to our podcast. A graduate of Dartmouth Medical School and board certified in internal medicine, he has advanced expertise in integrative and functional medicine. With a previous position as a staff physician at Canyon Ranch Health Spa, Dr. LePine is committed to assisting patients in achieving optimal health and vitality. Thank you so much for joining us today, Dr. LePine. I know it's been quite the hectic schedule, so I appreciate you sitting down with us for a few minutes.
Sure, you're welcome.
I know this is an anti-aging conference. It should be easy for you to go back to your childhood and think back to your youth. So what first initially inspired you to go to medical school? Were you always interested in the sciences?
Well, I was actually always interested in science. I was one of those kids where I had a chemistry set and I made volcanoes and smoke bombs in my basement and dissected frogs, and I was always this curious kind of kid, and my parents encouraged that. I come from a family of dentists, so there's no medicine in my family. And then as I went through school, I learned biology and biochemistry and things like that. And I like people, so it was a natural fit for me. If I wasn't a physician, I don't know what I would do, but I really enjoy I love what I do. It's not really work; it's my passion.
And where did you go to school?
I went to undergraduate at Holy Cross College. I was a chemistry major, and then I went to Dartmouth Medical School, and then from there I did my training in internal medicine. I did 2 years in San Antonio, and then I finished my last year up at Dartmouth Hitchcock in Hanover, New Hampshire.
And you've always practiced up north?
Yes, I always practiced up north. It's an interesting story of how I got into practice, because when I was just finishing my residency, I'm looking for a job. And this was in the late 80s, 1989, and most people then were joining groups. And I'm done the day, and I'm reading this throwaway medical journal, and it was an article about a physician retiring in Stockbridge, Massachusetts, which is where I live. And it was the same physician that's in the Norman Rockwell painting with the little boy bending over to get a shot in his buttocks. And it said that he was been the town physician for 50 years, and he was looking for somebody to take over his practice, but nobody wanted to do it because nobody was going into solo medical practice. And I said, I know the area, and I said, that sounds like an interesting opportunity. So I called him on the phone and left a message, and his wife had actually died. He was down in Florida, and he returned the call 2 or 3 weeks later, and I really forgot about it. And we talked on the phone, and then he invited me up, and I came up and saw the area and saw the opportunity, and I said, I'll just give it a try. So I did it.
I gather the painting didn't come with the practice?
No, I wish it did. It'd be worth millions. It'd be very nice. But he was a really nice guy. He was a down-to-earth family practice guy. Been there for 50 years, seen and done everything. And in walking into his practice, it was like walking back in time. He had all kinds of stuff, and we talk about today, about electronic medical records. He kept all of his medical notes on index cards.
Oh, fascinating.
It was a very, very simple way of practicing medicine. He knew his patients, and he would just write, a little mental note on what he did, and that was it. It was interesting.
Remarkable.
Yeah.
So how long did you have that practice before you moved over to Canyon Ranch?
Yeah, so I did regular sort of. I'm really trained in internal medicine, but I did family practice. I saw children ages 12 and 13 and up, and I was doing that till about 2004. And then from there, I transitioned into fully integrative and functional medicine.
What was the catalyst?
Well, the catalyst is I hit a wall with treating patients. When you're trained in regular mainstream medicine, it's basically pharmaceutical, so you're either going to write a prescription or you're going to refer them to a surgeon. That's really the two tools that you have in your black bag. And for a lot of conditions, especially acute conditions, you break a leg, you're having a heart attack, interventional surgery and pharmaceutical medicine works quite well, but for chronic conditions, it doesn't work well. In fact, you probably do more harm than good. So I was hitting a wall at trying to help my patients, so I just, I'm curious, so I started reading, what can I do? So I was learning about nutrition, diet, botanical interventions and things like that, and it just sort of evolved. And then I was also fortunate because I live in the Berkshires, and Canyon Ranch, which is a renowned health medical spa, was there, and they had just moved there, and they were looking for physicians, and they contacted me, and I ended up associating with them, and I was actually working in my regular practice and there sort of as a part-time kind of a job, because I was still building up my practice. And so I got a really good involvement in integrative medicine through working through Canyon Ranch.
And how many years were you there?
I was there probably a good 8 years, yeah. Yeah.
So I know that today you're connected and affiliated with Dr. Marc Hyneman.
Yeah, in fact, it's interesting because Marc also worked at Canyon Ranch. I was actually at Canyon Ranch before Marc Hyneman. In fact, I always joke, I taught Marc Hyneman. So,
That's
yeah.
great. That should be on your bio.
Right.
So how did that connection, was it through Canyon Ranch that you?
Yeah, so Marc Hyneman ended up joining Canyon Ranch also. Marc LePine was there, and some other physicians, and he and Dr. LePine ended up writing a book, Ultra Prevention, which is really sort of rebranding and marketing of the foundation of functional medicine. And that sort of launched his career, and he's a great physician, great writer, and great communicator, and he's been able to promote functional medicine to the masses.
And he thanks you.
Oh yes, yeah, right,
right?
yes, right. Yeah, anytime Marc gets stuck, he comes to see
I'm
me.
sure. So when you transitioned your practice initially, was it actually over a period of time and that you left practicing traditional medicine? Because I know you'd mentioned that you were still in the process.
What I ended up doing is after I left my regular practice, I went full time at Canyon Ranch. So that's how I sort of transitioned, if you will.
Okay.
Yeah.
So how did you start to focus the majority of your, whether it's research or practice or what have you, on mitochondria and the microbiome?
That's interesting. So yeah, those are really my two interests. I'll tell you the interesting story about the microbiome is when I was a medical resident, I had a patient who had hepatic encephalopathy. You probably never heard of that. I worked at the VA.
I can't even spell it.
Yeah, right. So I worked at the VA hospital. At the VA hospital, a lot of World War II vets were alcoholics, and if you become an alcoholic, you destroy your liver and your body's ability to detoxify. And there's a condition where it's called hepatic encephalopathy, where your liver really almost sort of shuts down, and you go into a coma. So I'm just a young, wet behind the ears medical student, and I see this guy come in with hepatic encephalopathy, and he was literally like in a coma. And the way that we treated him is we treated him with intravenous fluids. We gave him antibiotics. I recall it being neomycin. We gave him laxatives, lactulose, and we also gave him probiotics, which was actually innovative at the time. And within 24 hours, he woke up from his coma. And what it was, the thing that put him into hepatic encephalopathy was an imbalance of the gut microbiome combined with liver detoxification problem. And it was like Lazarus came back to life, and it was like a really amazing thing. And I said, well, what's going on here? Well, how did this guy go from being almost dead to waking up the next day by just sort of flushing out his system? And what was it in the gut microbiome that was causing this? Because the microbiome produces lots of chemicals, some of which are toxins, and if you don't clear that in your liver, you will go into a coma. So it was pretty, so it sort of piqued my interest, and from there I started learning more and more about the role that the gut microbiome plays in health and also disease.
So how does that come into play in the day-to-day patient that comes to see you? Absolutely,
it comes through everything. So the gut microbiome has actually been linked to cardiovascular disease, we call cardiometabolic disease. It's been associated with obesity, it's been associated with diabetes. There's a connection between autism, there's a connection between Alzheimer's, also recently even a connection between Parkinson's and the gut microbiome. So, and most of us don't really think about the gut microbiome because it's, it's inside of us, and we eat our meals and go to the bathroom 1 or 2 times a day. And you can actually analyze the gut microbiome, and you can see how healthy the balance of the gut microbiome is. And when you eat food, not only are you eating it, but the bacteria inside of you are eating it also. So you're feeding the microbiome. And depending on what kind of food you eat, if you're eating food that sort of pushes the microbiome in an adverse way, you get an imbalance of the microbiome. And likewise, if you eat healthy foods, you're pushing the microbiome in a more diverse and a robust manner. So your food influences your microbiome, which in turn influences your health.
And this concept and logic, as it seems to me, you learned after medical school.
Oh,
you
totally,
learned
totally
only
after.
when you went into
Totally
your
after. Yeah,
integrative
this was not taught to me in regular medical school. And I really have to credit Jeff Bland, who's really the father of functional medicine. And I'm a sort of a science geek nerd. I love my chemistry, biochemistry. And the first time I heard him speak, I was working at Canyon Ranch, and Kathy Swift, who was the head nutritionist at Canyon Ranch, she invited the physicians to go to a conference that Jeff Bland was giving on functional medicine. And the first time I heard him speak, it was like, this guy is speaking my language, because he was able to connect the dots and really show you how the microbiome and the mitochondria and diet and nutrition all fit together to create what we call health. Health is the natural state. Disease is when things are out of balance.
So some of your areas of interest that I've been able to research on your bio include IBS, autoimmune conditions, mood disorders, biodetoxification, and gastrointestinal health. This list seems, seemingly endless. So are there any conditions or specialties or disciplines in which you are most interested, other than obviously what we just talked about that you've in terms of looking at the mitochondria?
I think one of the big things that we're seeing today that it ties in with what you're just saying in terms of my interest is what I call the gut-brain axis. So the gut has a brain unto itself, and the microbiome actually talks to the body and talks to the brain. So a lot of people who have anxiety and mood disorders, the reason why they have that, it's not so much in the head, it's in the gut. So it's sort of all connected that way. So it's not just giving them the pill because they're anxious or depressed, but it's like, well, asking the question, well, what's causing that? Because the natural state of a human being is to be calm and happy. That's our natural state. And the way in which we're using processed food, we're using antibiotics, is really disrupting our bodies and our microbiome and our mitochondria. And this is now manifesting in all the conditions that we're seeing, which is chronic fatigue symptoms, depression, anxiety, autism, ADD, a whole variety of different conditions that are impacted by the influence of the gut microbiome axis.
So to that end, who would you say is your typical patient now?
Oh, it's my typical patient is the patient who has gone to a doctor with a laundry list of symptoms and has gotten a pill for every one of their ills, but has not actually looked at why they're having their symptoms. So there's a complex web that's weaved when there's a person's out of balance. And I go back to Jeffrey Bland. Jeffrey Bland wrote a fantastic book called the Disease Delusion. And in mainstream medicine, we have the ICD-10 codes, which is probably the bane of my existence, which is to say that you've got 40,000 different diseases, but they're really not 40,000 different diseases. You have 40,000 manifestations of imbalances and imbalances of function in the body, which we then label as a disease. So if diabetes was one disease, then one pill or one treatment should take care of it. But it's like Baskin & Robbins. There's 23 flavors of ice cream. There's 23 flavors of diabetes. There's 23 different ways in which you can develop diabetes. So you've got to look at all the different factors of the physiology in the body that are causing a person to develop what we label diabetes.
So what modalities are you utilizing today to assess a patient? I
actually use a lot of modalities. In general, the patients that I see are the ones who are sickest. They've typically seen all of the specialists, all the ologists. They've also sometimes seen other people who have already done integrative approaches that maybe don't have as much experience. So when somebody comes to me, oftentimes they're sort of a clinical puzzle. So I play like a medical detective, and I gather lots of data. I do nutritional, metabolic, genomic, toxin testing to really assess what's going on with them. So when somebody comes to me, I don't just draw their blood. I do blood, hair, urine, saliva, and stool. I mean, everything short of a biopsy.
You go back into your basement in your parents' house.
Exactly, right. So I'm playing mad scientist, if you will, and trying to collect the pieces of the puzzle. And in general, you can practice what I call, shoot from the hip type of medicine. You can give them certain types of things and see how they do. But for the really more complex patients, you've got to do this deep diagnostic testing and deep dive into what is going on with their overall health that's driving their conditions. I listened to a talk by Dr. Richard Horowitz yesterday on Lyme disease and chronic infections. It was a brilliant talk, and he talks about how all of these, what we call stealth infections, can be driving people's health conditions. And unless you're doing the testing, you're not going to find it. So when somebody goes to a patient, to their doctor, and they're feeling bad, and all they get is a cholesterol and a blood sugar and a chem panel, and they say everything looks good, I can't find anything wrong with you. Here's some Prozac. That's not what's going on. That's not what's really driving their symptoms. And Dr. Horowitz talked about the epidemic, really, of Lyme disease and tick-borne co-infections, which we see up in the New England area. I've seen patients come to my office manifesting having 20 years of fibromyalgia. All right, fibromyalgia is not a diagnosis, it's a symptom complex. And this patient actually had undiagnosed chronic Lyme disease that was causing fibromyalgia. I've seen it manifest as multiple sclerosis, chronic fatigue symptoms, Alzheimer type symptoms, even autism. So it's one of those things where you've got to do a deep dive and ask the right questions, and then in turn start doing the appropriate testing. And my analogy, I tell patients, they always come in and you say, you're doing a lot of testing. And I say, well, if you have a 1,000-piece jigsaw puzzle, you can't see the picture until you have at least 500 pieces put together. You can't see it with 5 pieces. You've got to gather the data.
And if you don't exactly do the complicated Lyme disease testing, how are you able to identify what is in fact, from one disease from another? Because so many of the results seem to overlap, whether it's lupus and MS and fibromyalgia, et cetera. How can you possibly diagnose something like that?
Well, again, see, that's actually the thing is I actually like to say to patients, I actually don't diagnose you. I am actually looking at dysfunction. Okay, so in the same way that somebody can carry the diagnosis of lupus, and there's 10 ways in which you can get lupus. So you've got to figure out, okay, is it Lyme disease that's driving your lupus? Is it Epstein-Barr virus that's driving your lupus? Is it gluten that's driving your lupus? Is it heavy metals that may be driving your lupus? Or a combination thereof. So when you practice integrative functional medicine, you have to be sort of a non-linear thinker. The body doesn't work in a linear fashion. It works in a complex network fashion, and it's related to, if you will, pattern recognition. Some of that comes with just experience. I mean, good clinicians are people who have seen lots of sick patients. They've done lots of testing, and they have this sixth sense of knowing, what are the imbalances, because it's never really one imbalance. It's usually a combination thereof.
So what is your typical day like?
Typical day is I'm seeing patients usually from all over the world. At the UltraWellness Center, we get patients from, you name it, from Hawaii to New Zealand to China and Dubai. I mean, it's just, it's actually very, very rewarding, because I get to help patients who really have reached the end of their ropes. I had this young woman who came over from England, and they have a national healthcare system over there, and not that national healthcare is a bad thing, because I think it can be a good thing, but in general, national healthcare systems are built on the acute care model, where if you're bleeding, they'll treat you, and if they break your bone, they'll fix your bone. But if you have a complex chronic disease, which is really what most conditions that people have, they're much more complex, and they require in-depth nutritional, metabolic, toxic, genomic testing to acquire that information. And she came over to see me, and she was, with chronic fatigue and just sleeping all the time and brain fog and such. And it turned out that her 2 major issues were related to chronic Epstein-Barr virus reactivation and gluten sensitivity. And once I addressed both of those issues, her life has been transformed. I had a follow-up with her, and she's doing fantastic, and she is now, has her life back. She's, a young girl in her early 20s.
Amazing. So what does that feel like for you? I mean, obviously.
It's very rewarding. Medicine is really about the relationship that you have with the patient. It's not, you don't treat diseases by themselves, you treat people with diseases. And you have to be a people person, I think, to be a good clinician. It's an interesting balance because, as a clinician, if you don't care, you're not a good clinician. And if you care too much, you're also going to be drawn into the whole process. So you have to be a caring person, and at the same time be able to sort of distance yourself, because you see a lot of trauma and tragedy and people's stories and things like that. So there is an emotional and physical toll that it can take on you if you don't recharge your own batteries. But it's very rewarding. It's very. I love what I do because it's not work. It's like solving puzzles and helping people. Those are fun things to do.
So if a young college student said to you, "So Dr. LePine, I'm interested in going to medical school," what would you say to them?
That's an interesting question. I would basically tell them, get your medical degree, but learn about integrative and functional medicine, because that is the future of medicine. It's the future of chronic care medicine. Again, if you're a surgeon and you're doing acute care medicine, that type of training, orthopedic, OBGYN, trauma surgeons, brain surgeons, that's the kind of medicine that saves lives in an acute care situation. But if you're going to be a regular endocrinologist, gastroenterologist, internal medicine doctor, learning integrative and functional medicine is the future of medicine.
What is that?
What is that? So
what is that? How do you define it?
It's an interesting thing. So integrative medicine is basically expanding the tools in your black bag. I mean, I took over Dr. Campbell's town practice, and the old doctor had a black bag, and in the black bag, basically the two tools in physicians' black bags in mainstream medicine today is either a prescription pad or a scalpel. All right, and those are great tools when you need them, but you need to expand the tools in your black bag with integrative approaches. So some integrative approaches include dietary interventions, nutraceuticals, supplements, vitamins, stress management, mind-body medicine, neurofeedback, using exercise and different types of exercise, strength training, high-intensity interval training. So there's lots of other tools that you can use which are very simple in some cases. I mean, breathing exercises, stimulating the vagus nerve through deep breathing exercises to invoke the relaxation response is one of the biggest tools that I use that is cheap and there's no side effects. So, that's really sort of, what integrative medicine is. And functional medicine is just a way of thinking about that. So functional medicine, you're trained to think in systems biology so that you're able to connect the dots to see what is causing a person's dysfunction, not their disease, but their dysfunction.
And so you've described integrative and functional, and what would anti-aging mean to you? What is that?
Okay, I actually don't like anti-aging. I don't like the word anti-aging. I like the word optimal aging, because we're going to all age. The question is how well are we going to age? And most people, I tell them that I'm not an anti-aging doctor, I'm an optimal aging doctor. And most people will be very happy as they get older if they can remember the names of their grandchildren and play with them and get down on the floor. Those, so we can move and we can think and remember their names. That's really healthy aging. Obviously, you don't want wrinkles and you don't want loss of strength and flexibility. Those are things that we all want and aspire to as we get older. But what we're really looking at is how can we age well, so that we're vibrant and alive in our 80s, 90s, 100. I can remember when I went skiing up in Colorado at Beaver Creek. I was in the bus that takes you from the parking lot to the ski resort, and I'm sitting next to this guy. He's a 90-year-old neurosurgeon, and he's vibrant and healthy and alive and doing well. I said that's what I want to be doing when I'm 90.
Did you ask him what protocols he was using?
No, I didn't. No.
Next time you see him, you might want to do that and implement that.
Exactly.
Do you see the patient that just comes to you and says, okay, what can I do to just remain healthy?
Yes, yeah. I mean, there are patients who come who are looking for preventive medicine and optimal health, absolutely. And there's a lot of things that you can do for that. I mean, the big things for that is, make sure you're getting adequate sleep. Make sure that you're moving your body, make sure that you're dealing with stress properly, and also avoiding toxins. Toxins is the big, elephant in the room. I could go on for, a long time talking about how we live in a toxic environment. And in fact, one of my interests is autism. Now, autism is an epidemic in America. Mainstream medicine has no approaches for it whatsoever. They have no clue on how to treat it. They have no clue on what's causing it, because we have this pharmaceutical approach where you have to have this pill to treat a disease. And if you don't have this pill, then we don't have anything to offer for you. Well, autism is really the clinical manifestations of genetically susceptible individuals during critical times of neuroimmunological development are exposed to a host of environmental toxins. It's not just one thing, it's a combination of things. And these young children with autism are canaries in the mine of living in what I would call a toxic environment. We are living in you actually can measure the toxins that we're exposed to, including pesticides and herbicides and all different chemicals that we breathe in, that we get through our water, compounds that we're exposed to, flame retardants in clothes and furniture. And this sort of whole barrage that we're exposed to has a toxic toll. Now, some people are better at detoxifying. I call the people with the George Burns gene. They can have a cigar and 2 martinis and live up to 100, and they're fine. But some people are more genetically susceptible to toxicity.
Are you attributing this happening in utero or after?
Both.
Okay.
Both.
And I know that there's been a lot of controversy over the last 15, 20 years in regard to vaccinations.
Yeah.
And what is your philosophy on that?
Well, my philosophy on vaccinations is I have seen personally, and I've heard stories from patients and also other physicians, that a child was developing completely normally, got their vaccination, and developed what is called a autistic spectrum disorder. Now, interestingly, I'm talking today about mitochondria. There is actually a case of a child of a neurologist who actually sued because he really knew the story, and his daughter got a vaccination, the MMR vaccine, and was completely fine. That was the trigger that developed her to develop autism, and it turns out that she had a undiagnosed mitochondrial disorder that then was flipped, if you will. The metabolism and her whole physiology was changed after the vaccination. So there's a connection between vaccines and mitochondria and autism. That's part of the whole puzzle. So in certain individuals, without question, vaccinations can trigger disease or dysfunction, which we label as autism spectrum. Big Pharma will tell you otherwise, but it's not true. I mean, we see it clinically, and the problem is the biggest thing is this: we have what's called a vaccine court. Prior to I forget the exact year, there were so many people complaining of adverse effects from vaccinations that the Big Pharma had themselves indemnified from harm, because they were being sued, and they were saying, well, we can't continue to produce vaccinations because we're being sued too much. So now you can't actually sue a vaccination manufacturer. You've got to go to this indemnification court. So the very fact that that exists tells you that vaccines are not what they are purported to be.
So why wouldn't they come up with a way to test mitochondria prior to the 2-year-old?
We actually ought to be doing that, exactly. We ought to be testing. And in fact, that's actually an interesting question, because a friend of mine, Dr. Bowles, who is a pediatrician whose expertise is in mitochondria, there are certain tests that you can actually do. And I would venture to say that if you're going to vaccinate your children, you should actually get their mitochondria and microbiome tested prior to giving them vaccinations.
So you can do that on a 2-year-old?
You can, yes, absolutely, yeah. And you can find those who are more susceptible to oxidative stress with some of the testing related to mitochondrial function.
So are these simple blood tests? Are they saliva tests?
Some of them are blood tests, and some of them are buccal smear tests, sort of like 23andMe is DNA testing. And I'm not a mitochondrial specialist, but there are what we call mitochondrial, mitochondrial dysfunctions, that some people may have weakened mitochondria. And it doesn't necessarily manifest as disease, but their mitochondria, which is how your body produces energy, may not be functioning optimally.
remarkable. I really am blown away by this whole thing, and there's just so much controversy.
Oh, yeah.
That they're really, with this type of information and this type of, you could prevent, and but granted, there's the whole host of the other side about, starting a school and various states and boards of education and whatnot that won't allow students to attend unless they've been vaccinated.
Well, yeah, that's it. And when you really look at it, I mean, kids also are getting multiple vaccinations simultaneously, and all of the studies have been done only in individuals. Not I call it the cocktail effect. And one of the other things that's also really another part of the whole vaccination study, and obviously each vaccination is a different. Polio is different than MMR, which is different than the Hib vaccine, et cetera, is that there are also adjuncts in vaccinations. And if you go to the medical literature, you will see that the aluminum, which is actually used to provoke an immune response, is one of the things that also triggers autoimmunity in adults. And I had one woman from Russia who, to come over to the States, had to get her vaccinations. And she says that she developed adult autism after she got her vaccinations.
Goodness.
Yeah.
There's a tremendous amount of literature out there, I'm sure.
Yeah, and again, I'm a clinician. I'm not doing the popular. I'm treating patients in front of me. That's really what I do. So all I can do is I can hear and listen to stories. And there's a saying that if you want to get the diagnosis, listen to the patient. That's all you got to do is listen.
So isn't that harder today for the traditional practitioner who's staring at his computer and his back is to the patient?
Yes, because they're actually part of they're a cog in the medical and industrial complex. We talk about the military industrial complex. The medical industrial complex is even more deadly. Have
you had to overcome any criticism by any of your peers in your community regarding how you practice medicine?
Yes, but that doesn't. I welcome it because everything I do is really based in hard science. So I welcome anybody who's questioning what I do, and I'll back up everything that I do by the medical literature and my clinical experience. And the nice thing about doing integrative and functional medicine is use the term in Latin. It's called primum non nocere. First, do no harm. And in general, most of the treatments that I'm using, which are not pharmaceutical, really the risk-benefit ratio is very, very good. There's very little risk, large amount of benefit. So I don't feel, I've never had any patient that I've seen that I've used, alternative integrative treatments who's had any kind of adverse effects.
But I'm sure you've seen a lot of patients who have been treated the traditional way and been given a multitude of pills who have harmed themselves. So there's a lot of irony there.
Yeah, exactly. The biggest problem that I see when patients come to see me is what I call the disease called iatrogenica imperfecta, iatrogenic illness, doctor-induced illness. I've seen more people come in on polypharmacy, poly drugs that are this cocktail that is never been studied because you can check for drug-drug interactions, but no one's ever looked at the long-term effects, especially in young kids who are put on a whole host of psychiatric medications. I mean, it's very, very sad. I mean, we're drugging young people because they won't sit down in school. Well, young people are they're active and they want to be running around, and we say, oh, you've got ADD, and here's a pill, and just sit down and shut up. It's crazy.
So where would you like to see integrative, functional, optimal health, wellness medicine be in 5 years?
I would like it to become more mainstream. There's some movements about trying to get integrative and functional approaches into insurance models. I'm not really sure that is necessarily the best way. I think the free market is probably a better way. I think to some degree the insurance model has actually driven up the cost of healthcare because you get a lot of overhead, and the insurance model is also they're sort of the middleman, and they're a for-profit industry. So insurance companies actually want to collect your money and not give it out. So I'm not sure what the best model is in terms of getting this to the mainstream masses, but I think that through the use of the internet and the expanse of knowledge, people are going on to social media, they're Googling, and they are demanding integrative and functional medicine. It's a wave that is just out there, and it's getting bigger and bigger. And interestingly, also, some of the patients that I see are actually physicians. So when physicians who have access to the best surgeons and the best specialists who give you the various medications are not getting better, you know that functional medicine, integrative medicine has now reached a critical point where it is now the driving force in how we best treat chronic conditions.
Have you seen any of those physicians, or physician patients rather, have you seen them transition over to practice?
Absolutely, because they're seeing, it's an interesting thing. I think most people get involved in integrative and functional medicine either through a personal health crisis or a family member's health crisis. That's really oftentimes the catalyst that drives it. Otherwise, people are just sort of like looking like I did, which is basically trying to say, how can I best help the patient, with whatever conditions are coming, because I'm hitting a wall at, just giving them pharmaceutical approaches.
So what do you see for yourself for the next 5 years, 10 years?
What do I see for? Actually, I really want to be an ambassador to integrative and functional medicine around the world. I've actually lectured across the United States and various parts around the world to really inspire people and give them, share the knowledge that I have, and really get people fired up, because what I do and what most physicians should be doing is they should be enjoying their life. And I think that doctors in the 5-minute medical visit where you treat them and street them, what's wrong with you? You've got pain. Here's your opioid. See you later. That's not fun. That's not good medicine. And I think that it's a time for a change. It's a time for a change. I mean, when you look at the opioid crisis that's going on in America right now, that is big pharma and 5-minute medical visits as a cause. Period. It's sad. People are dying from that.
I think we'll leave it at that. It's a very strong message to end on.
Yeah.
Thank you so much, Dr. LePine.
All right. Thank you.